I just turned around. All righty, folks, we are live here. Welcome to South Radiology's Department Huddle with our very own special guest in-house. We have here the Director of Case Management, Amy Jo Rosenbaum. I had to read that because I didn't want to mess up her name. She's coming to us in the office so we can go over some definitions of what exactly do certain acronyms mean, okay? Now, I must say that Amy Jo wanted to make a TikTok instead of a YouTube, and I don't do TikTok. So we're doing YouTube, okay? We ain't doing none of that, all right?
I wanted David to dance.
Yeah, I'm not doing none of that. All right, here we go. Welcome, Amy Jo,
Thank you.
as our special guest to discuss the acronyms of what y'all hear every day. Discharge planning. Like I said, Amy Jo Rosenbaum has been the Director of Case Management for the past 3 years. She's been directly involved with case management for the past 7 years. She started off as our very own ED night shift nurse. Matter of fact, Amy Jo and I were probably started around the same time. So that's going to be a trivia question for 500 CUDA points. And I won't give it away just yet, but I'll ask the question at the end of this department huddle, so that way I can make sure y'all stay engaged, right? That's how I make them stay engaged with kudos. Go. It's like, it's like a treat, right? We love our kudos. All right. So first and foremost, I have to say thank you very much for taking the time out of your very busy day, because I know it's busy because we have a meeting coming up. Okay.
Thank you.
So can you discuss what your role is in your department?
My department is in charge of discharge planning for every single patient in the hospital. That includes the initial screen, making sure that they go home set up with home health. Do they have their DME? Do they need to go to rehab and IV antibiotics set up for home? All that.
Wonderful, wonderful. How big is your team involved in case management?
We are a small team of only 6 case managers, and we cover the entire hospital and the surgical hospital as well. We touch a lot of lives with a very small amount of people.
Okay, that is a small team. At first, I was going to be like, that's a lot. That's a lot of on your team, but for 5 floors and then basically 2 floors at surgical. Discharge planning, folks. Discharge planning. You hear that every day from me. I go to MRI, IR. We need a line. They're going to be discharged today. We have a fluoro study that they're pending discharge on the results. As you can see, we get from all angles, ultrasound, IR, nuclear medicine, MRI, radiology, diagnostic, CT. Okay, so every single employee here in Radiology South plays a role in the discharge planning, whether you realize it or not. So with that being said, can you share with us what LOS means?
When I talk about LOS, I'm talking about length of stay. Length of stay is super important to our ministry and to our hospital here. Just a brief overview, length of stay plays an important part because if we keep the patient too long, it has to do with payment. And so it allows us to be the most efficient and the most cost effective for our hospital, for our ministry, for us to be able to keep our doors open and to keep treating the people of our community. If we keep patients too long past what payments are allowed or things like that. Of course, we're always going to ensure the safety of the patient, the wellness of the patient first. But we have to be timely, and we have to be effective, and we have to make sure that we're following up things in a timely manner to be able to be profitable, to be able to keep our doors open. That is what length of stay is all about.
Thank you. On the average, what would you say the average length of stay is about running these days?
Our average length of stay here is about 3.5 days.
Okay. So if a patient is not readily physically capable of being discharged at the 3.5 day, let's say they're at day 5, day 6, do we recoup payment? Do we get paid for those extended days after?
We do. We follow up with the physicians, but it all depends on their documentation.
Okay. Is there ever a point in time where the insurance company says you're only allowed at 3 nights and you went past your 3 nights that the hospital has to eat that cost?
Yes, there is.
Okay. Wow. Okay. That's length of stay, folks. And we'll keep it short and simple because we're at the 4.5 minute mark. So we're going to march on to the next acronym. OBS. Can you define OBS?
When I say OBS, I'm talking about our observation patients. Every single status that the patient is here in the hospital matters. So if I say observation, that means that they're here for a short stay. We're only doing a small workup to rule something out, and usually it's less than 48 hours. because it's a different kind of payment. If I say that they're inpatient, that means that we anticipate a stay longer than 48 hours. And there are certain criteria that they have to meet for insurance purposes to be considered inpatient. We cannot just make patients any status that we want, because we get denials and the whole stay will be denied and the claim doesn't get paid at all.
Yikes.
We also have extended recovery. Those are mainly for our orthopedic patients, surgical patients, elective surgeries that stay overnight and are discharged promptly the next day. So every single status I overview for every single patient in the hospital to make sure that we're able to recoup, because if they're not in the right statuses, the insurances will deny the whole claim and we get zero payment.
Thank you for that. Now, what happens if a patient is just not capable enough to take care of themselves at home? What's the next stage for that patient?
So we do discharge planning from day one. And so sometimes these patients require a skilled nursing. You'll hear me say the word SNF, and that is rehab at a nursing home. There's two sides to a nursing home. There's the patients that are there long-term. They live there as residents. And then there's a side to every single nursing home where they just go there for rehab. Let's say they had a knee and they're unable to take care of themselves. They just need a little bit more therapy to be sure to be safe at home. They stay there about 7 to 10 days once the insurance approves, and then they discharge home.
Wonderful, wonderful. What is the highest amount of patients we've discharged here at Spawn South within a 24-hour period?
We just hit that record here today.
Oh,
we
really?
Actually hit 40 discharges.
What?
We've never hit 40 patients in one day. The team here, the collaboration, which includes all of y'all, you'll see me reach out to Jennifer and to David to say, hey, I need to read on the CT. Hey, can we get the results on this MRI? Because if that's negative, the patient can discharge home in a timely manner.
Yes.
So that's how every single one of y'all are important to everything that we do every single day.
And what would you say the record is for the lowest amount of discharges in one day?
I think the lowest amount that we've had one day was probably like 12.
Wow, that is low, right?
Our job is super important because throughput within the hospital affects everybody. It affects how many of the surgical patients get to come up in a timely manner instead of having to wait in the PACU. It affects Jane and her ER so that they're not holding so many patients in the ER and they're not on ER stretchers, which is not very comfortable. And they're able to come up and get better nursing care in a room, in a private room. We want to make sure that the patient is happy, and patient satisfaction is a big here at Spawn South, and we do a great job. Everyone does a great job. So it's all very intricate system and we all work together.
Very good. Very good. Folks, we are at the 8-minute mark, so I'm going to wrap it up at this point in time, but I just want it for documentation purpose so we can cascade all this information out. And from time to time, at least quarterly, we're going to basically be discussing topics that I am not the subject matter expert on. Amy Jo is the subject matter expert on that. So from time to time, we will have guest speakers to be able to discuss those questions. If you have any questions or any clarifications you need, put it in the group chat. I'll forward those to Amy Jo and we'll get an answer for that here. For 500 CUDA points, can you share with us in the group chat how many years Amy Jo has been an RN? So with that being said, Amy Jo, I want to say thank you very much for taking the 10 minutes out of your very busy schedule. And I look forward to collaborating with you on a daily basis so we can get these patients out the door, out of the hospital, at home to be able to recover better, because there's no place like home to recover.
There is not.
There's no place like home to recover. We've all had loved ones in the hospital, okay? Every other hour, somebody's in the door to either take your menu, draw your labs, take your vitals. Let's utilize the hospital stay for what we really need, but then let's get them home where the real healing begins. Again, I have to say thank you very much.
Thank you for inviting me, David, and thank you each and every one of y'all for what y'all do each and every day. Thank you.
Awesome. And Amy Jo, I wasn't recording. We're gonna have to do this again.
What?
I'm kidding. Stream is ended. That was just a rehearsal.